but you would then lose whatever the employer pays toward your premium. So generally, if you're offered coverage at work, you can't go to the exchange and get a subsidy unless it's not affordable to you. And there's a technical definition of what affordability is, but in simple terms, if you have to pay more than 9.5% of your wages for the premium toward your employer coverage, then it's considered under the law not affordable. And if that's the case, then you can go to the exchange and be eligible for a subsidy based on your own income.
Does veterans' compensation count as income in this scenario?
The exact breakdown of how income is counted, to be honest, that's a level of detail that I'm not able to speak to today. But if someone is receiving that compensation, when they go to someone to help them sort through their enrollment options, either over the phone, online, or in person, they'll be able to get help to answer that question.
My question is in regard to the use of a panel to decide the efficacy of treatment for someone who happens to have a history of costly treatment. Who will decide if treatment is given at all?
So it sounds like that's referring to a rumor that's circulating out there, often called a death panel. That does not exist. It is not true. It is not a part of the Affordable Care Act. There is no panel you have to stand before to determine whether or not you will get treatment.
I think it's sorry.
No, that's all right. Most of those issues are always issues that are dealt with between the member and their provider. In some cases, health insurance companies do have clinical experts who meet and use the existing clinical literature to make determinations about which kinds of procedures make sense in which kind of diagnostic situations. And usually those decisions are made between members and their physician or in collaboration with a health plan.
And just a quick note there too. In Melanie's presentation, she talked about something called the essential health benefits. I think if you look at the package of essential health benefits, you'll find that there's pretty comprehensive coverage. And she also mentioned too that the fact that there will be preventive coverage, not only preventive coverage, but separate preventive coverage for women's services as well, which have been added. So I think the basket of benefits that everybody is going to have access to is going to be different and better than what they've seen today.
Another question. Can you change your choice of coverage the following year if unsatisfied with initial selection?
Yes.
Will there be a bronze, silver, gold, or platinum option for those who are city employees, Buffalo Police Department, who presently hold Blue Cross and Blue Shield, or would one of 4 options be chosen for the employee?
Well, I'll take that since I'm from Blue Cross Blue Shield, but actually, because the City of Buffalo is a large employer and they're offering coverage, and I believe that the police union contract coverage would be considered affordable because I think based on the contribution level. So as a result, the city workers would not be going separately to the exchange. They would stay with the city plan.
Anyone else on that? When will the state start trainings for navigators in CAC that are placed in qualified facilities?
I can take that. They've already started the training. The initial training was, I think it was the 3rd week of August here in Buffalo, and I believe they were offering trainings in other locations. And I attended the training, and several other groups had people from all over Western New York, as far as I think people were there from Syracuse and Rochester and the South Towns. So the training has started. And as I said, there's additional trainings being offered the 3rd week of September, and maybe others.
Yeah, there's a robust training schedule underway so that there will be all those people who are able to help people enroll in person will of course be trained by October 1st, ready to go to hit the ground running.
Can an individual or family currently with health insurance expect the premium to decrease? Will premiums decrease overall?
So I touched on this a little bit when we talked about the plans that have been certified across the state. The premiums for individuals and families compared to what they are today, on average, decreased by about 53%. When you look at the whole state, in terms of whether an individual would see a decrease from what they're paying today, they'd have to go to the marketplace to check that out to see how their individual situation would be affected by that, as well as to see if they're eligible for those financial assistance options we talked about.
Could the definition of small employer and small businesses be given again?
For a small employer for eligibility for the marketplace, it's 50 or fewer employees or full-time equivalent employees.
How often will plans change? Will plans be available in October 2013? When will new be added, and do we need to get updates? Will the plans be changed?
On an annual basis, we anticipate that we will be filing the plans that we want to have approved on the marketplace. So on a regular annual basis, there may be additional benefit options that are available or changes to the existing ones that are out there.
Here's one for each of you. How is your organization effectively rolling out a plan to capture the uninsured who don't have internet access?
Currently, Kaleida Health has a large facilitated enrollment team, and we currently will do home visits. We will meet people in the community. We will meet people at the bedside. And with this program kicks off on October 1st, not only will we have navigators within our hospital facilities who can assist individuals, but we also have established a community location located at 1028 Main Street, and that site will be open Monday through Friday, some evenings until 7, and we'll also be offering Saturday hours. So we will have in-person assisters available. We'll also have a computer set up for people who wish to come in and apply on their own.
Yeah, and I think there'll be a lot of assistance for people that don't have internet access. The exchange itself will have the phone center, so you can actually call the phone center and instead of enrolling online. There will be the navigators, as we just heard, and there'll be lots of other help available. And then we will be having, people that call us, we'll be able to help them as well and help direct them to either our direct products or through the exchange, whatever is more beneficial to them.
How many navigators will be available, and how will people find them? Have the navigators been hired to reflect the uninsured? Have the navigators received cultural sensitivity training?
So yes and yes to the last two questions.
Yes
in
and
terms
yes.
of the yes, in terms of the navigator organizations, I believe there have been 50 different organizations that have received that grant funding we talked about. They're all available online on that website we talked about. If you want to see the map now, you'll be able to see those groups. Yes, it is 50 organizations throughout the state. They're supported by 96 subcontractor organizations.
And all
So
train.
I talked about how they had to apply to a grant-funded program. Part of that application process included giving lots of details about what their proposed program would look like. That includes how they're going to reach the very specific members of their community. They had to describe what their community looks like, who they target, what services they provide now, how they really plan to, again, reach all those different community members across the great diverse state of New York. Including things like language access, having site locations that are able to be frequented easily by the different members of their community, and also looking at things like language access, making sure that they have navigators who can speak the languages within their community, and then of course the call center will be able to help people as well, especially even those navigators who, if someone comes to them, they speak a language that's not able to be spoken by some of the staff within the navigator organization. Those people can pick up the phone right there with the person. That navigator can sit with them and go through the process over the phone.
The state is doing all the training?
Yes, the state is doing an official state-approved training program for each of those 3 categories of helpers we talked about, the in-person assisters navigators, the agents and brokers, as well as the certified application counselors. All of state-approved training programs, so anyone who's able and has been certified by the state to help you enroll through the marketplace, you'll be able to find those people through the website and over the phone.
Can you say the 3 different positions the state is training for?
Sure. So they're people who can help both individuals and small businesses. The 3 buckets, the way that they're described, as you saw on my previous slide, they're the official organizations that have received those official grant funds that the state set up, called the In-Person Assister Navigator Program. There's also the agents and brokers, who are licensed professionals who today help people enroll in health insurance. This is essentially targeted for small businesses, but they'll be able to help individuals as well, should they choose that. And the certified application counselors. So the person who's looking for help, they don't have to know those 3 buckets. I don't expect them to be able, I don't expect that they would want to pick, oh, I want to speak with a certified application counselor. They don't have to figure it out like that. They would just call the call center or go to the website to see where they can get help in person, and the marketplace will tell them all the different people who have been officially trained by the marketplace, by the state, to help them enroll in person.
And I just want to add that the training also includes a section on HIPAA, so that people understand their obligation regarding privacy. There's also a section in the training about cultural competency, assisting people who are differently able, people who may be hearing impaired. So the training is really robust, and it does address diversity. It does address, people who have disabilities, and also privacy.
Right. Here's a question of concern. I'm retired. My health care is currently provided by my employer. Can I expect my health care to be dropped by my employer since there is no penalty? Concerned when I retire, employer dropped my insurance because there's no penalty for them.
There's no obligation for an employer to provide coverage today. There's no obligation for an employer to provide retiree coverage today. The employer that does that for reasons that we've talked about in terms of attracting and maintaining talent, and in fact, in the contract with their employees of why they signed on. So it's hard to answer that question specifically, but in general, I think it's good to keep in mind the fact that there has been no obligation and employers do provide coverage.
And I just add that if, unfortunately, that person's coverage is dropped, of course, they're able to go to the marketplace to get new coverage. We're really geared towards helping a whole range of New Yorkers, but even those people who today, especially those early retirees, that's a key target population that, as we understand it, Congress had in mind to really help that group as well. So before you're eligible for Medicare, your options are today somewhat limited. If you aren't able to purchase coverage directly and you don't have the employer option. But that's essentially the concept of the marketplace. We're there to help people apply for the public programs if their income puts them within that program. We're also there to help people, really that whole class of people above the public program eligibility line and up to the Medicare line. Again, there's nothing stopping someone who's eligible for Medicare from going to the marketplace. It just means that you wouldn't be eligible for that financial assistance to help you pay for it.
Can non-citizens in this country here on school visas get health insurance, and how much?
So to use the marketplace, you have to be a U.S. citizen or legally present. So to the extent that that visa student would be legally present, yes, they could use the marketplace. Exactly what it would cost would depend on where they live. Just tell the marketplace that information. They'll be able to see the options available to them.
Can you speak on what is offered in prevention and wellness benefits that will be in the exchange insurance programs? Thank you.
Sure, that's the fun one.
Yeah.
I think we all probably want to answer that one.
Want to start? Go ahead.
I'll start because I'm going to.
Before you answer, I think you want to listen to this about prevention, because I think this is no, it's not a classic. This is innovative in my thinking.
So the Affordable Care Act recognizes something really important in healthcare, that it's better to address health concerns up front. not just be there when people get sick. And to do that, it eliminates barriers of cost to people to get that kind of coverage. Getting a colonoscopy is not the favorite thing in anybody's world, but having to then go there and pay a lot of money for that is even more insulting. So what this says is, you know what, we'd rather pay for that. You go there and make sure that you are clean, or if there's anything we can take care of to prevent cancer, that's great. So actually the Affordable Care Act has $0 copay for a number of preventive services that are being defined by the U.S. Preventive Task Force Service, as well as specific services for women that have been identified. There's also in the package of essential health benefits that New York State has. New York State has a package of essential health benefits that includes a wellness benefit, a gym benefit actually, that was based on a plan downstate. You will see health plans offer not just that kind of gym benefit, but also other types of wellness benefits. For instance, we have a nutrition benefit that we're using for that. So there is a lot in the Affordable Care Act, opportunities for prevention and wellness, and I think the plans, that's the most exciting thing, I think, in our perspective about the opportunity to create these products is this wellness prevention piece.
Yeah, I mean, as we say at Blue Cross Blue Shield, healthy changes everything. So we are very excited about the preventive aspects, and the idea that the law, as Roberta said, takes away financial barriers to getting preventive services. So for physical exams, for example, have a $0 copay. Pediatric services and immunizations and screenings, not only colonoscopies, pap smears, mammograms, all those proven preventive services have no copay when you go there if you're under one of the plans.
Can you speak to the circumstance of additional insurance for senior citizens covered by Medicare and need something to cover the 20% not covered by Medicare?
Well, there are a full array of different kinds of options for individuals who are 65 and over and eligible to participate in Medicare benefits. There are Medicare Advantage programs, and each one of these local carriers offers an array of Medicare Advantage programs that will take care of those 20% coinsurance features of your existing plan. There are supplemental Medicare plans. There are a whole array, and I would strongly encourage you to investigate those options because there are many available, and some of them are available to you at a $0 premium. So there is no additional incremental premium to pay for those plans.
Are you able to tell us the amount of the discount for the low-income workers for each healthcare company?
Well, it gets a little complicated. It depends on a lot of specific information, like people's incomes and the type of plan that they're looking to enroll in, et cetera. So we would encourage people to, once the website gets up or the marketplace gets established, to check in either online or calling up or going to, Kaleida is one of the navigators that'll be available because it's very specific to each individual person.
What do you say to this person? Income between $1,600 and $1,700 a month, single, pre-existing conditions, do not work, 63 years of age, do not have any insurance, need to know different costs. What would you say to that person?
The advent of the healthcare marketplace is a perfect opportunity for you as an individual to become aware of what the options are going to be to help you get access to health insurance. On the basis of the income level you're reporting, it would seem that you are going to be extremely pleased to know that I would think your subsidy level will be quite significant. It will probably cost you next to nothing to have very good, high-quality health insurance. And the best way for you to get the information about what the options are that will be available to you based on where you live and what your what other particular life situation is. There may be factors that would make certain programs more advantageous for you than others. Strongly encouraging you to take advantage of the marketplace in a few brief days when it will be available.
And also, you cannot be denied coverage for a pre-existing condition.
Will plans offer out-of-network coverage options? Will transitions to new plans be immediate and smooth, no gaps or delays in coverage?
I think that many of the standard plans are based on a particular type of a program that does not offer out-of-network coverage, but I would strongly suspect that there will be many options available that will offer some level of coverage for members who seek care outside of a health plan's particular network. And I apologize, Jim, I didn't get the second question.
Will the transition be smooth and immediate and without delays?
The transition from whatever type of a program the individual is in before they take advantage of access to the programs. I will say that our organization has been involved in the testing process with New York State as an early adopter health plan, and there's been a great deal of activity going on to try to make sure that any little kinks are out of the administrative process. So from all indications, we're quite hopeful that it will be a very smooth transition process into your new product option.
And regarding the out-of-network benefit question, I just add that while out-of-network benefits are not part of the essential health benefits, they are going to be available at the silver and platinum metal level. So we talked about those 4 different levels, the way the plans are sorted. So you can look for out-of-network benefits, yes, within the silver and platinum. And again, when you go to the marketplace, you'll be able to look up all the details of the benefits of what's included. You can look at things like the provider network. If there are particular doctors you want to keep seeing, you can look to see what networks they're participating in. If there's a particular facility or hospital that you like going to, you can make sure that's within the network as well. You can also look at things like the formularies to see if there's a particular prescription drug or drugs that you want to make sure are covered as well. All those details are available through the enrollment website and through of course, the call center, and the in-person helpers can help you get that information as well.
It's been said that one size doesn't fit all, and that in this scenario, you would have the options to have multiple coverages, that the child may be covered by one plan and the wife may be covered by another. Explain.
Typically, in many employer situations, an individual employee might be covering themselves as well as their spouse and their children under the employer option. But with the advent of much more affordable individual access to insurance programs, I think some of the statistics that Melanie mentioned earlier about a 53% reduction in premium specifically has to do with individuals who need to go out on their own and try to find an individual insurance contract. Those are the folks who are going to discover that access to their own individual coverage might be much more affordable than it ever was in the past. In some situations, you may discover that you as an employee have coverage that's affordable and accessible, but once you get up into the family coverage and covering your spouse and your children, it becomes maybe a little bit more of a financial burden. You may say, well, you know, my spouse is now Medicare eligible. Maybe I'll go out and buy an individual Medicare contract. And I mentioned earlier, some of those are available at no premium. Or if you have children, based on your income level, they may be eligible for individual insurance programs through the marketplace. Child Health Plus, there are other options that are available based on your income, and splitting up the family's access and having perhaps even 3 different insurance companies across your family is not unforeseen.
Is there a dollar ceiling on the amount of coverage a certain plan can offer?
If the question, I think the question is there a maximum amount that the health insurance plan would pay for a given illness or whatever? And one of the provisions of the Affordable Care Act was to eliminate lifetime and annual dollar maximums on essential benefits. So where policies in the past might have been capped at a certain dollar amount a year for certain services, that goes away under the Affordable Care Act, if I understood the question correctly.
How will people be penalized, or will people be penalized if they don't enroll in an insurance plan? Also, what are residency requirements?
Well, if people don't have insurance, and if they don't, they can have insurance in many different ways, through their employer, through Medicaid, through Medicare, through military coverage, whatever coverage that we think about qualifies. But if somebody chooses not to have it, there is a penalty in the first year of $95 a year, or 1% of income, and that goes up over the next several years. But that's the penalty for not having coverage if you're required to have a coverage under the law. That's the penalty for the first year for 2014.
Got an age question. Are students or dependents still covered up to the age of 26?
Yes.
Yeah.
That was
That's
easy.
been one of the most popular things about the Affordable Care Act, is that young adults can stay on their parents' policy until they hit 26. And that's been a big help to a lot of young adults who are in between jobs, or between college and jobs, or between training and jobs. And sometimes they're working part-time and their employer doesn't offer coverage. So it's been a big help. It's probably been the most popular thing about the law.
As it relates to your different companies, will there be competitiveness in pricing? Will you be working across the line equally so, or does pricing vary with each company?
I think that what you'll see is the Western New York insurance market has always been very competitive in terms of having three very strong organizations competing with each other in the marketplace to try to attract new customers. So I think that we will continue to see all three of us trying to come up with the best possible lowest cost products so that we can maintain our competitive position.
That completes my questions. So to the panelists, including you, Melanie, is there something you think you should share with us that may not have gotten raised or that you didn't get a chance to speak on?
I would just like to add that Kaleida Health does have navigators, and we will have certified application counselors available. We're preparing for October 1st, and we'll be ready to go. As I mentioned, we will have folks inside our hospital facilities, but for those people who may not be our patients or maybe a small business owner, we will have a community location at 1028 Main Street, so that anyone would feel welcome coming in for assistance, and we'll be ready to go October 1st.
And we've been around at Blue Cross Blue Shield since 1936, so we've seen a lot of change in healthcare, and we've been with people, helping people through all those changes all these years, and we're going to continue to do that, and always glad to talk to anybody about their options as well.
And just a strong encouragement that if you feel confused about all this or anxious or not sure what to do, there are plenty of people just like you who are confused and anxious, and many, many resources available. So please don't hesitate to come to any of the resources in our community, including the marketplace, including any of your local insurance plans. We will get you the help and information and direction that you need.
And I'd just say October 1st is right around the corner. Please, on October 1st, remember the marketplace and check us out online, over the phone, or in person.
I'd like to say WUFO 1080 AM will be doing periodic programs providing further information, and hopefully to have some of these panelists be in on the show. And Doris Corley, would you please come here for a moment? Is that a question you got for me? Oh, well, I don't have a question for you. I just wanted to have everybody recognize the person who coordinated today, did the work, and Doris Corley. Oh, okay. Okay, if you have any further questions after, you can outside, you can leave information, we'll get back to you. You can call your council person. Like I said, there'll be events like this going on throughout the city. There's one on next Monday, the 16th, at SEIU. That's the at 2421 Main Street.